So I presented on a simple 4-step technique that I use on virtually everybody when I do injectable fillers in lips. I start first with filling in fine lines. So in those individuals 40, 45 and older, fine lines and wrinkles become part of the aging appearance around the mouth. And paying attention, having a very fine hand, a technique where a very thin needle is bent in a certain way at a 45-degree angle, and you can fill in with tiny amounts of filler those lips in a very natural way that most lips you can make look either gone or nearly completely gone. Second part of the technique is also using a small bent needle, and I inject a very tiny amount of filler along the outline of the lips. Virtually everybody that I do filler on in lips, I do this technique of outlining the border of the lips, even in younger patients, because it makes a lip, it defines a lip in a really attractive, beautiful way without looking obvious to the rest of the world. And it does it in a way where the patient sees a difference. They like the way it enhances the shape and the appearance. By doing that technique, you can also take care of subtle little asymmetries, and you can enhance things like the Cupid's bow, which is a beautiful part of a lip, rather than just overfilling it and it looks like a lump. So that's the second technique, is I carefully, with tiny amounts of filler, outline the lip. The third technique is for women who want slightly fuller lips. And so that third step that I do is I add a little bit of volume to the lower lip and the upper lip in a way to create those natural kind of pillows on the lower lip rather than this full stuffed sausage. And then same with the upper lip. And then I will shape it with my fingers just like a sculptor will shape to make sure it's symmetrical, to make sure it's nice and smooth and even. And then the fourth step to the technique is addressing the downturned corners of the mouth with a little bit of filler. And I'll also use a bent needle, 30 gauge or small needle, and I'll elevate the very corner of the mouth slightly and then fill in any depression that might be there. So that 4-step technique is what I have done for years. I've, at this point in my career, probably done 4,000 to 5,000 lips, and with using that particular technique, and I have a very big lip practice because of it, and I probably do 2 to 5 patients a day with their, to do filler in their lips. So I love doing lips. Lips should look beautiful. Fillers are great in lips. There should never be a bad outcome with filler in lips.